Bacteria and other microorganisms are easily transferred from contaminated surfaces and objects to the hands. Hand washing is the most effective way to reduce the spread of infection. Healthcare workers should wash their hands when arriving at work, anytime an employee uses the restroom, after eating or at the end of a break. Hands should be washed before a patient exam.
How are you feeling this morning?
All right.
And hands should be washed after a patient exam.
Bye-bye.
Hands should be washed before gloving. And they should be washed after gloving. Hands should be washed immediately after coming in contact with an object that potentially has been contaminated with blood or body fluids. Hands should also be washed after handling specimens. Healthcare workers should always wash their hands before going home. Hand washing can be accomplished using one of several different methods. Choosing which method to use depends on the amount of visible soiling on the hands and the activity to be performed. The use of soap and warm running water is acceptable for routine hand washing. Visibly soiled hands should be washed with a product containing an antiseptic cleanser and water. Alcohol washes are also an option and are found throughout healthcare facilities. This method of hand washing can inhibit the growth of microorganisms, but is not acceptable when hands are visibly soiled. The effectiveness of hand washing is directly proportional to the amount and frequency of the product used, the technique used to wash hands, and the acceptability of the product. The step-by-step procedures for hand washing are the same for non-antibacterial and antibacterial soap. In most institutions, wearing minimal jewelry is acceptable and does not need to be removed with each wash unless hands are visibly soiled or contaminated. Fingernails should be trimmed and should not extend more than 1/4 inch past the nail bed. Wearing artificial nails should be avoided. Stand away from the sink to avoid the contamination of clothing. To begin washing, turn the faucet on with your hand or use a foot control to start the flow of warm water. Allow the running water to thoroughly wet both hands. Apply the appropriate amount of soap, usually 3 to 5 milliliter per manufacturer's recommendation. Rub hands vigorously for at least 15 seconds. All surfaces of the hands and fingers should be covered. To avoid contamination of the arms, point fingers down and rub hands in a circular motion starting with the fingers and moving toward the wrists. After completely rubbing each surface of both hands for at least 15 seconds, begin rinsing with warm running water, keeping fingers pointing down. Rinse all surfaces. There should be no visible soap remaining on the hands. With fingers pointing up, use a dry disposable towel to dry hands thoroughly. The water should be turned off by using a foot control or by using a dry paper towel. An alcohol hand rub is appropriately used throughout the day. Remember that this method is not appropriate for visibly soiled hands. Dispense the manufacturer recommended amount of alcohol-based gel, usually 3 to 5 milliliters, in the palm of the hand. Rub vigorously, remembering to cover all surfaces of both hands and fingers. With an alcohol rub, continue to rub until both hands are completely dry. Hand washing is the most important activity to prevent the spread of infection.